So I'd like to welcome everyone here today. David Smith, Mayor of the City of Bunbury, Marilyn West representing the Department of Health and Ageing, distinguished guests, ladies and gentlemen, and members of our South West Medicare Local. That sounds so exciting to say that. My name is Suzanne Leavesley and I'm very proud to be the first CEO of the South West Medicare Local. We were very excited to be awarded the first rural and remote Medicare Local in Western Australia and to be one of the first 19 Medicare Locals in the first tranche in Australia. My role is to start up our new company, and my role today is to be your Master of Ceremonies. I'd like to acknowledge the Noongar people, traditional owners of this land on which we meet today, and to invite Elder Lyra Bennell to welcome us to country. So Lyra, if you could join us, please. Thank you.
Thank you. Wow. Do you know what it feels like to me right now? A real culture shock. There's only 3 Noongars in the room. My name's Lyra Bennell. I'm a Balladong, Wilman, Wadandi woman. My connection to this country goes back to the days before colonisation. And I would like to take this opportunity to acknowledge all our Noongar people, both past and present, who have lived, walked and looked after this land and maintained the cultural values held so dear and strong to us all. As a member of the local Noongar people, I extend a warm welcome to you all and all who are visiting Wadandi country. Today I have 4 challenges that I would like to put to you. Number 1 is for Medicare Locals to be complete all health checks and healthcare plans for those clients who are currently receiving ongoing treatment for chronic disease and introduce self-management of health. The second one is to complete all of the follow-ups for chronic disease clients to ensure continuous care. 3 is to ensure that regular screening is carried out on Aboriginal persons who are not being treated for chronic disease. And believe me, there are so many out there. And number 4 is to ensure that proper opportunities are provided, healing of Aboriginal families to prevent suicides and combat the growing use of drugs and alcohol. We had a suicide in Donnybrook about 3 or 4 weeks ago, and we have concerns that it could be ongoing in our community. So I would like to leave that with you. I believe you're all the experts and the professionals in this field. So I'd like to thank each and everyone here today for acknowledging the Noongar people, the traditional owners of this country, by allowing me to welcome you all to our country. Kia. Thanks.
Hiya, Lara. Thank you so much for doing that welcome to country for us. It's my pleasure now to introduce Elizabeth Barnes, who's the chairperson of the South West Medicare Local and of our company name, the South West Health Alliance. Elizabeth, we welcome you to address us. Thank you.
Thank you, and thank you for all coming today. I really appreciate a full room, it's great. And I would like to say thank you to Lyra for giving us those challenges, because they absolutely allow me to illustrate what we're going to do with our South West WA Medicare Local, because there's a lot of need out there. Those 4 points that Lyra just raised are just the start of it, and we need to know about that. That's how we're going to operate. We need to know about the needs. And that's why we're inviting our members and inviting the community. Please let us know. Let us know what those needs are, because that's the start of the journey of getting them sorted out. And this is what the Medicare Local is for. The Medicare Local is not a service provider. So our organisation here is not going to employ staff to go out and meet those needs. But what this Medicare Local is going to do is to find out what the needs are out there, and then we're going to say to the community, how can we solve that? Who can come up with economically viable, sustainable ways to solve these problems? Who's got the most innovative ideas? What's the best way to deal with primary health care in our region, which goes all the way up to Jurien Bay, all the way up to Southern Cross and nearly to Ravensthorpe, down to Albany, Augusta, Bustleton, Bunbury. It's a big region, there's a lot of issues out there, and we together, not the employees of the Medicare Local, but all of us, the community out there, the members, the service providers, together we're going to solve it. And that's what the Medicare Local's about. And I really welcome you here today because it's the first step in that journey of us doing it together. The first person is on our board. He's a GP, Dr. Chris Plint, who's here from Bunbury itself. I'd like to welcome Chris. Thank you.
Welcome, everyone. I intend this to be somewhat of a GP perspective, and hopefully GPs are going to remain an important focal point of the Medicare Local. Can I start by saying that the ideal of health reform in the primary healthcare sector is comprehensive, affordable health care. And for as long as we've known general practice, the ideal of general practice is comprehensible, affordable health care. GPs have always, have traditionally been the gatekeepers of healthcare. So in the perfect utopian GP world, how could this take place? And you may be thinking, well, he's obviously going to say the Medicare Local, and you may be correct. If you analyse what GPs do, you would understand better that a fully evolved Medicare Local would undoubtedly improve and enhance general practice and patients enormously. The important thing to remember is, in this whole scenario, is that the patient is surrounded, is the most important entity, surrounded by their families and the community at large. And this is where general practitioners are most effective and have the greatest influence. And this is what the Medicare Local seeks to support through health population planning and by plugging service gaps. GPs do not provide a service in a vacuum, well, not an effective service anyway. They require a team of coordinated and integrated in an effort to provide the most efficient and cost-effective service. At present, there is a great deal, as we're all aware, of fragmentation, inefficiency, and expense in primary health care. What the patients and the community need is a more collaborative effort. And this will be provided, we hope, in the future by the Medicare Local. This is our brief, and this is what we're going to set out to achieve. So in conclusion, the patient is really central and the most important part in all of this. Always our focus in general practice, and I guess in any health situation. A healthy community is crucial, and a well-organised healthcare, possibly an ideal, is imperative. This can be achieved by the Medicare Local in support of general practitioners.
Thank you very much, Chris. As we can see and hear, general practice remains very much central to our primary healthcare model in the southwest of WA, as does pharmacy. And we've been thrilled that we've had so many members enrol with us who are pharmacists. And we've invited Matt Tweedy, who's the director of the Pharmacy Guild, to come along and talk to us today about how he can see the Medicare Local working well with the pharmacists.
Thank you. I too would like to acknowledge the traditional owners of the land, the Noongar people. I'd especially like to thank Elizabeth Barnes, Chair, for the invitation, to Susie, CEO, for her invitation. I'd like to acknowledge Yvonne Robinson, Tarina Grace and June Falls, all here from the divisions, well, two, Yvonne and June from the divisions of general practice, and of course Tarina with the challenge of North Perth Medicare Medicare Local. Trip over that one. In being asked to come and give a pharmacy perspective, I had to give this a fair bit of thought. The first question, of course, in doing all of this, and it's been answered, does the primary healthcare sector have to change? We know it does. And to us, Medicare Locals represent the best opportunity to implement primary healthcare reform, and certainly in my last 20 years of health management, that I've ever seen. But they also represent the highest risk to the government, to the minister, to the Medicare Local itself and its board, to its stakeholders, and ultimately, most importantly, to the public. If this fails and falls over, health reform in the primary healthcare sector in Australia will be set back by decades. So everybody sitting here, I think, understands that and believes that they have a commitment to it, and that's probably where I started to shape our belief at the Guild, and certainly through our members, as to what we can do to make sure this succeeds. It's not a matter of maybe or if, we have to make this succeed. And when I looked at this particular Medicare Local, and it was described before, the biggest risk it's got is its geographical spread. It's huge. In fact, all of the rural country ones are. And so for this one to work, we believe it's going to require a committed, engaged, and it's already been asked for, knowledgeable and informed participants. It's going to require, as a critical success factor, a relationship and a stakeholder engagement strategy and all that entails. It's going to have to achieve the level of governance, accountability, outcomes, equity, progress you want. Engagement with that spread of health professions and communities you've got is going to be your biggest challenge and hurdle. So how does pharmacy fit as a solution in that? There are 61 pharmacy sites in your Medicare Local. They're staffed, they've got paid for infrastructure, they've got a workforce, they provide free access to a health professional, university trained of course. They're connected, 100% of pharmacy is ITIM enabled and do it as a daily practice. They're networked by an extremely powerful peak body, unashamedly I say that, because if I didn't I probably wouldn't be standing here. They're regulated to within an inch of their life. In fact, I came to the Pharmacy Guild as CEO of Canning Division of General Practice, so I had a completely different view of pharmacy before I walked in the door, and I've never seen anything. And my previous life as a health service manager looking after hospitals, I thought they were regulated. They're nothing compared with pharmacy. So they are regulated, they're measurable, they're scalable, and they're service providers. And the clincher is they're completely underutilised. So just some closing observations. The model that this particular Medicare Local has developed makes sense. It's informed, it's manageable. To get it to work, I think it's going to be reliant on the hubs, the information in, the relevance, the local nature of it, and it's informed health information from communities. So pharmacy stands by, happy to participate, more importantly capable of participating. We wish this Medicare Local all of the best. We want it to succeed, and everybody in this room needs it to succeed. We're but one provider in the sector. However, I guess in closing, we across WA, and we being the pharmacy community, are actively engaged with each and every Medicare Local. Very excited by the opportunity, and thank you for your time.
Thank you very much, Matt. I think, Matt, you've highlighted how innovative we need to be and how keen we are to work in partnership with everyone that's here today. It's such an exciting opportunity for us to engage with allied health and with pharmacists and people that we never thought of before. And I was just passing through Darken last Friday, and I know of a particular physiotherapist who runs the bookshop in Darken, and she's renowned for the wonderful kind of health hub work that she does. And I walked into the bookshop and there she was making a coffee while she was giving advice about someone's physiotherapy for their neck. And meantime, while she was serving ice creams, I was lobbying her if she would be very keen to form a health hub, which she said she would be delighted to do. And again, this is the kind of thing we're looking to do for the future. We know in the past that we've had people who've said it would be great if we could have the podiatrist visit us, and yet, you know, there is no podiatrist and they are 2 hours drive away. So we've been very innovative with Commonwealth funding to encourage the podiatrists to go to town, and then over time they build up their own caseload and they don't need the rural primary health support. So we know that we can do it, but we do have to think outside the box. And this is why we've invited Glenn Power, who's the CEO of the South West Aboriginal Medical Service, to talk to us about how he thinks we can work together with SWAMPS. Thank you.
Thank you very much, Suzanne. It's really a pleasure to be here, and thank you, Suzanne, for the invitation to come along and just say a little bit about SWAMS. We're an Aboriginal community-controlled health organisation, and our catchment and our client base runs from it's a fair overlap to the Southwest Medicare Local catchment. We begin at about Waroona and span the area from Waroona around to Manjimup and east to Narrogin. We operate from 3 clinic sites, 2 here in Bunbury, a medical clinic with 5 doctors involved and about 30 practice staff, including Aboriginal health workers, outreach workers, to help us case find and navigate the community, and obviously the full suite of allied health. We've got a full-time physio on board recently, and looking to set up sessional arrangements with a number of other providers. So the epicentre for SWAM's activity is really here in Bunbury, but we're trying to innovate and deliver services and bridge the access gap, and we've recently been lucky enough to receive some support for the development of a mobile clinic service, which we're going to take out to the outlying towns and trying to reach our client base more effectively. And the first port of call, I think, for that service will be in the near sort of penumbra to Bunbury, maybe Brunswick, where we know there's a general practice gap and certainly a significant Noongar community. But beyond that, certainly we've got an ambition to be elsewhere in our catchment and as much as we can. So it's that kind of innovation we'd like to bring to the thinking and our interrelationship with the Medicare Local into the future. We're very excited, and we congratulate you for your formation and look forward to working with you. Thank you.
Thank you very much, Glenn. And so we're excited too that our membership now is growing, and we have AQUA and SWAMS, both as Aboriginal and community control groups, working in partnership with us. And we will be looking to recruit more member directors. We will be having elections very shortly in the new year for member directors. I'd like to now invite Elizabeth, as chairperson, to come up and look to cut up the cake and to do the official bit of the launch, if you would.